Okay guys, I'm back. So of course I forgot something about the day in the life video that you guys just watched, so I'll add that here. I just forgot to add in that we do see patients at least one day a week. Dr. Summersgill has been splitting that between Tuesday and Wednesday mornings. Dr. Bilodeau used to see patients on Tuesday mornings, but basically everything has kind of changed around because of COVID, but usually one half day per week we see patients at a minimum, and then I think there's opportunity to add more as COVID kind of dissipates. In addition, we do get consults from the dental students and the dental residents throughout the week, throughout the days each week. So technically the dental students are supposed to come at 11 and 3 o'clock, and then the residents can come at any time. We also see patients in the hygiene department if they need a consult. So we do get patient interaction here. I just forgot to say it in the last video. For the rest of this video, I'd like to talk about the traditional pros and cons that we talk about our program versus other programs. Obviously, all of the programs are great, and you're going to be able to pass your boards and become a great oral pathologist no matter what, but it is a place that you're going to spend for 3 years of your life, and so I think it's good to just kind of know the pros and cons. So I have a little list here. So the first pro that I talk about with Pitt is that we do have 3 attendings here that were all trained at different institutions. Dr. Summersgill is the program director. He was trained at Iowa. Dr. Prasad trained at Queens, and Dr. Bilodeau trained here at Pitt. So I think it's very difficult as a first year because you're at the scope and you feel like you can't read anyone's mind and you're like, am I wrong? Like Dr. Summersgill would sign out this case like this, but Dr. Prasad is saying that, and Dr. Bilodeau says something completely different. So it's a little bit confusing as a first year, but at my point in time as a resident in my 3rd year, I think it's really great to be able to see how all different attendings approach these different cases and just be able to pick their brains about how they interpret different things under the microscope and how they interpret different stains. I just think it's really interesting to have that diversity. So I think that's great. Another pro of our program is that we have a really great working relationship with ENT pathology. Like I was kind of talking about in the previous video, we do 4 weeks of rotation with them every year. And I know that's different from other programs and it might seem like a lot, but it's because they are literally the world experts on especially salivary gland pathology. They're also really well renowned in thyroid pathology and just head and neck path in general. And so having that great working relationship with them is really great. And this year they don't have an ENT fellow. So I think that we are going to be relied on even more to help out, and it's just a great learning experience. And to be able to absorb any amount of brain cells from Dr. Seethal, Dr. Kiyossi, and Dr. Peel is just awesome. And it's a really great, advantage to our program. Another pro that kind of goes along with our working relationship with ENT Path is that we learn a lot of our general pathology by going on rotation. We're kind of treated like the general pathology residents when we go on rotation, and we learn how to work up sarcomas. We learn how to work up lymphomas. We learn how to work up all these other entities on different benches, and it's a very active learning environment, and it's not just a passive, oh, read this chapter in the book about sarcomas. We're the ones who are ordering the stains and ordering the levels and expected to present these patients at sign out. And it's just a really great learning experience. And it's very different from the other programs. And I don't know, I think it's really interesting. UPMC, University of Pittsburgh Medical Center, is really well renowned in pathology just in general. Their path program is really competitive to get into from the medical side. So I think for us to be exposed to those learning methods is just really interesting and a really great way to learn as a resident. And then I think the 4th pro is, in general, I think that Dr. Summersgill, as the program director, takes a very hands-off approach to how we are learning. I guess when you talk about what the definition of a resident is, it's this combination and mix between being an employee and being a dentist already and knowing how things work and being expected to work at that level, but also you're still a student and you're jumping into a completely different area of dentistry and you are here to learn and kind of hone your skills. I'd say at Pitt, we are treated much more on the spectrum of an employee than a student. And I know that that can be a pro for some people and a con for others. For myself, it was a pro. I was really burnt out at the end of dental school, and I was ready to not be treated like a student, and I was ready to not be expected to do a lot of homework and extra assignments and just kind of random things to almost force me to learn. I'm happy that we're kind of expected to be here at certain times to do our jobs, but that when we don't have anything going on, we're allowed to just do self-study and look at slides on our own and read research papers and go ask questions to other attendings, go finish up cases that we were working on other benches, go observe surgical procedures in endo or perio or oral surgery. There's just a lot of opportunity for you to do what you want in your free time, which I think is interesting. So those were kind of the pros that I wanted to talk about. And then the negatives that I want to talk about, there's three things. So the first thing is that we do take call at UPMC. So UPMC, University of Pittsburgh Medical Center, has an oral surgery program, and they also have a GPR program. There are 3 GPR residents who each take 1 week of call per month. So Monday through Thursday, and then a Friday through Sunday call each month. The 4th week of the month that is not covered by GPR is covered by oral path. So currently Grayson is scheduled to take 1 full week of call every month. And he also has to take 2 holidays, and his holidays this year are Labor Day and New Year's Eve. Call is not fun. It's obviously not something that we in oral pathology signed up for. UPMC is a pretty major hospital and a major center where people need INDs and have dental facial traumas that we are, expected to cover. You do have a pager that beeps, and I have PTSD from hearing that beeper ring, and it's definitely, a stressful time, and you need to plan to not, do anything very fun for the week and weekends that you're on call. But that is the way that we are paid. We get paid quite a bit, and we're paid like a normal PGY1 resident, and that's because we do take call as a first year. So it's just kind of a trade-off. Call has been structured differently in the past. Currently, Grayson is just ripping the Band-Aid off, and he's going to get all of his call done this year and then not have any call for second and third year. Myself, as a third year, I've kind of had different structures of call just because we had a new GPR resident director come, and we also had COVID that kind of screwed everything up. So I took a full week of call, but it was actually split between my first and second years. So it still wasn't fun, and it was spread out between 2 years, but I also got more of a breather each month as in first and second year. This year I take second call, so if the resident on call needs backup, they would call me, and I would either come into the ED and help them, or at least walk them through a case from a logistics standpoint. I would say that call here is in between difficulty levels, so I've definitely heard of residents at GPR programs who call is nothing. They call in an antibiotic over the phone to the pharmacy, and they never have to go in, and they don't get many pages throughout the weekend. There are other people in GPR residencies who it's basically an oral surgery intern year, and they get called all the time, and they're expected to set mandibular fractures and do all these like major trauma cases and just do a lot of intense things. That's not us. I think we're in the middle. We basically do incision and drainages for any tooth in the maxilla and any anterior tooth in the mandible. And we're expected to help with traumas. So, a patient will be on their bike and they fall and crack their tooth, and, you throw some Dical on there and move on. We're also expected to set teeth. So if they fall and there's 2 teeth that are loose, you need to go into the ED and splint them together with composite and wire. It's not fun, you will get called at 2 a.m. to go into the emergency room to incise and drain a lesion. It's not fun. It's not what I set up for. It's not what I want to do with the rest of my life. But I do think it's part of our patient interaction experience here, and it's something that you can put on your resume that, if you want to get a job in an academic institution and they require people to take call, that's something on your resume that you can say like, well, I've done this, and I have this skill that is honed, and it's an asset to the school to hire me because they can get an oral pathologist who also, has this skill set. In addition, I think it's something that we can put down on our resume to prove that, we didn't just not touch a patient for the past 3 years. We've been doing pretty complex procedures that require a lot of skill and empathy and well-rounded dental skills in order to do the IND, or in order to, fix a facial laceration. So I do think that it's something that can be an asset, and it's something that I'm going to be proud to put on my resume, but it also was not very fun when I was actually doing it and dealing with it. So that was the first negative of our program, is call at UPMC. The second negative is shorter. We do gross every day here at Pitt. So we get around 15 specimens, I think we get around 10 specimens per day. And myself and Grayson are the ones who have to open all the bottles, measure the specimens, bisect them, and submit them for processing to be put on the slides. I think that there are many programs where you do a rotation in grossing, and so you are grossing specimens for a month, and then that's it, and you don't do it anymore for the rest of residency. I think it's a negative. I wish we didn't have to do it every day, but I also don't think it's the worst thing in the world. It doesn't take that much time. I think for myself, if we have 10 cases, it probably takes me 45 minutes total to gross all of the cases and dictate all the reports. Now, I think it'll probably take Grayson closer to an hour and a half, so double the time, just because he's slower, he's new at it still. But it's not something that takes, 8 hours every day where you're staying at work until 7 p.m. to finish grossing. We're usually out of here by 4 o'clock, and maybe on a late day that's really busy where we had more specimens, you're out of here by 4:30, 4:45. So it's really not like that big of a hindrance to our day. And then the last negative that I wanted to talk about is that we do have an emphasis on self-study here. So I know I talked about that in a previous section, I guess in the pros. Like I said, for me, I wanted to kind of be able to go to work and feel like an employee and not be treated like a student anymore, not have to be told that I have to do this assignment and this worksheet and this homework and write up these papers and, in a sense, do busy work. I think that the busy work can be helpful and can add structure to your program, and I don't necessarily think that it is always a negative, but for me, I didn't want that. But I still crave some more structure from our program at different times. So sorry, I don't know if I'm talking about this in a very clear way, but I would list that the emphasis on self-study and being an independent learner can be a negative at times. And I do wish there were days where we had more structure built in from oral path and maybe had some truly tailored lectures about different entities of pathology for us. We do learn about lichen planus in a didactic setting, but it's from a dermatopathologist, and it's the dermatopathologist is lecturing to the general pathology residents. And so it's not really a tailored lecture for what I need to know, because I do need to know and understand lichen planus at a higher level than the medical pathology residents. But I also need to know it based on what's going on in the mouth and not necessarily all the different presentations that can happen on the skin, like what a dermatologist knows. So I do wish that there were times where we had more structured learning sessions just for oral pathology. So I would list that as a negative of our program. I think this is the end of the video. That's all I can really think about. If you guys have any questions, feel free to reach out to myself or Grayson. I know Dr. Summersgill will have our contact information ready. And yeah, if there's any more questions, please reach out to us. And I wish we could see you in person, but I guess that's just the way it goes. And I look forward to seeing all of you guys at future oral path meetings, no matter what program you guys choose to go to. All right, have a great rest of your day. Bye.